Hi, my name is Valentin Kolev. I'm a gynecologic oncologist at Mount Sinai School of Medicine. I'm an assistant professor at the Department of Obstetrics and Gynecology. Cervical cancer is a cancer of the cervix, which is the lower portion of the uterus, and it is a condition that affects women at any age, and it's something that is actually completely preventable with pap smears, and it's caused by majority of the cases, over 99% of the time, by the HPV virus. The different types of cervical cancer are dependent on the cells that they arise from. So in the cervix, there's two major different types of cells. One is called squamous, those are the surface cells on the surface, and the other ones are called adenocells, or that means the cell that arises from the glands, which is from the canal of the cervix. The most common types of the ones that are from the cervix are called squamous carcinoma, and less common are the ones that arises from the glands, and they are called adenocarcinomas. Over 99% of the time, the cervical cancer is caused by a virus. It's called HPV virus. This is a virus. There are many different subtypes, and some of these types can cause these genetic changes in the surface cells of the cervix that over time can undergo changes and progress into cancer. The most common sign and the presentation for cervical cancer is having bleeding, abnormal discharge, and especially having some bleeding and spotting after sexual intercourse. Those are usually the hallmarks of the presentations of the early cervical cancer. The HPV virus is a sexually transmitted, and that's what actually causes the risk factors. And the risk factors is multiple sexual partners. Now there's a vaccine for the most common types of HPV virus that can cause cervical cancer. So now not being vaccinated is also a risk. And most importantly, is not having a routine GYN care by having pap smears. Also, it's something that can increase the risk for cervical cancer. And some of the other risk factors to mention is smoking. It has been found that smoking cigarettes also increases the risk for cervical cancer. Cervical cancer, like any other cancer, the treatment options are really dependent on the extent and the stage of the disease. If this is found early in stage 1 or 2, the options, usually we start with surgery, that is removing the cancer. And once the cancer is removed, that could be all of the treatment, and then depends on the risk factors, which will be how big the cancer was there any potential cancer left after the surgery, will determine if there's any additional treatment. But the major treatments are surgery or a radiation treatment with chemotherapy, or a combination of both. For early stage disease, which by that I mean for stage 1 and 2, this is something that is completely curable and curative. In over 80 to 90% of the time, the patients are cured. The recurrence rate, or what we mean by that, is this cancer coming back, is relatively small. However, if this is more of an advanced stage disease, if this is something that has developed into more advanced stage, to stage 3 and 4, unfortunately for these patients, the survival rates are like 50-50, about 40 to 50%. Cervical cancer is one of these rare cancers that it's 100% completely preventable just by having pap smears. And what we do when we do a pap smear is we do two things. We looked in the cells that we obtained from the surface of the cervix, and also we check for HPV virus. And if we find any presence of these high-risk HPV viruses that can cause cervical cancer, we take certain steps to diminish and to decrease the risk of developing into cancer.